catch these last few. I had to flip my phone around to make sure that I can see what's going on with my phone. Because, of course, the back of the camera is the best. But I had to flip it around. So hopefully I can get you guys that were on the live on the other one on this one. And then once I see people pop up, then I can see if I can answer the last few questions on this one. Let me see if I can share. Let me see if I can share this link. I probably can't. Let me see. Let me see if I can share this link to the old live. If y'all coming in, let me know in the chat. Let me know in the chat if y'all coming in, if you see me, if you were from the other chat. I'm trying to get my people back. Okay, let's see. Let me see if I can. Hi, Donna. I'm just trying to grab my people from the other live. Because something froze over here. So let me put that in this chat. And then we can keep going. Okay. Okay, so, all right, okay, perfect. Okay, I know it was some stuff in the other. Okay, I just put the link to the other live in there. So, let me see. I want to, hopefully, everybody that's coming in say something because I wanted to reply back to NA and to Juanita. So, if y'all are in the chat, let me know. Thanks for giving me those likes. I see it. I see it. I had to flip my phone around so that I could see what's going on because I don't know how it froze, but it did. So let me see. Okay. So hopefully they'll come on here, but let me go to the other live so that I can see what they wrote and go from there. So, okay, let me see. So, oh, the recommendation of hello. I love that name. Ha 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 ha. So the recommendation is for people going to nursing to study medicine, like I was kind of saying before my stuff went black, was a lot of PAs, a lot of physician assistants are people that want to get into being a doctor. With nursing, what you do, you go through nursing school, but see, your mindset is different. Your mindset is bedside, taking care of the patient. And even when you go from nurse to nurse practitioner, you have to debunk all of the bedside manner because what you have to do is what I'm a BBW. How am I a BBW? Because I got this I'm not a black beautiful women, not big black woman, black beautiful. Thank you. Because I'm a little self-conscious about this little extra right here, but I'm still small. So anyway, let me chill out. So PA instead of nursing to do that. Now let me go back to Juanita. One of them pays, one of the places kind of dependent on me. Could be 9 months. Juanita, if you in this live, you need to say something right now. Juanita, if you are right here, please say something because I need to have a conversation with you. The last live I ended because of technical difficulties. But Juanita, you telling me the one place depends on you and you can do it in, thank you so much. And you can do it in 9 months. When Juanita come back in the chat on this video, I need you to comment. I'm gonna go to the next one. Do you know how much doctors make compared to nurses? No, I don't. Thank you. I worked hard for it. I worked hard with 3 kids. I worked hard. Thank you so much. Um, okay, yep. And so now it's saying the screen is black. All right, so I'm gonna get off of that. But Juanita, you said, you said that it takes 9 months for you to get your bachelor's and it depends on you. Ma'am, if you don't get up in that school in the fall, please. What you mean, why don't we wear clothes properly? What that mean? I got a whole jumpsuit on. It's a whole jumpsuit. But anyway, what's proper for you? I mean, my husband likes what I wear, so is what it is. NA, are you on here? I need these 2 ladies that I'm trying to get back into nursing school to get their bachelors. I need them to be in. Oh, okay, it might be. I need them to be in the chats, because we was having a whole conversation. Please entering up. Juanita, okay. You have set goals. No children of yet. Okay. Not to get too much in your business, Juanita. You can't do 9 months of school. You can do 9 months while you're working. Everybody has set goals. Juanita. Okay, put it like this. Do you realize? Okay, let's back up. How long have you been thinking about getting your bachelor's? How many months? How many years? Tell me that, Juanita, because I know you've been in nursing for a while. I remember us talking on the last live 2 weeks ago, because I do them every other week. Come on. Put it in the comments. Okay, let me look at the other. Let me see. What are some tips to intern doctors to become helpful to? What are some tips to intern doctors to become helpful to nurses? I'm almost done with school and I'm unfamiliar with the relationship between residents and residents and nurses. Ha. So, hello from Japan. I got a brother-in-law is in Japan with a restaurant. What I will say. Thank you. Earrings. Residents and nurses are like, okay, put it like this. When you come up to a nurse and you ask simple things, make sure your attitude is together. And I'm going to say this because I've come across residents that are very humble. They're very sweet. Those get everything from the nurses. If you don't know something, you get all of the help if they have the time. Now, if you coming into, a facility and you arrogant and you a resident, we automatically know you don't know everything. You're a resident. You're learning. So if you come to a nurse that's seasoned with the attitude or you're arrogant, we're going to look at you and be like, I don't know. And we won't help you. We won't help you at all. So the relationship between nurses and residents could be perfect or they could be horrible. It's up to how you bring your attitude in, because all of us nurses that deal with residents have had good and bad experiences. When my first encounter with residents, well, it was the ER, but it was more so when I worked in the ICU. The residents was asking me, a nurse that's only been a nurse for 2 years, asking me what to do in the scenario. And I'm like, you don't know? So they literally was asking like the seasoned nurses, which I wasn't seasoned back then, the seasoned nurses what to do in this scenario. But they were very humble about it. They literally would sleep there. They had like a bunk bed, and they was doing what, maybe a 24-hour shift. So they had like a little bunk bed in the ICU so that they could take their little sleep or whatever. But it's all about your perception and how you're coming off. You do not want to come off as arrogant, like you already know stuff, because you're going to need your nurse. You're going to need them. 100%. Okay, let me go back. CJC. Uh-oh. Am I missing something? And Juanita, did you respond to my question? I don't see your response, Juanita. How long have you been thinking about getting your bachelor's? How many months? Oh, okay, I'm sorry. I see it now. You was typing some stuff. Let me be quiet. I'll read it. Let me get down to it. Okay. Let's see. So, Mr. Hernandez, it could be really good if you have the right attitude. Do not think that people are underneath you. Remember that we are a team, because with nurses and doctors, we need each other. With nurse assistants, RNs, LPN, we all need each other. We're a part of a team. Okay? All right. Let me go back. CLC, 15 months, LPN, then bridge RN, work PRN. Okay. I don't remember what I was saying for that. You can refresh my memory if I... Oh, you're probably saying maybe that's something that you encountered, the RN to BSN. I mean, LPN to RN bridge. Okay. Work per diem. Okay, it looked like time need to be oh, we could put people on timeout. Time, you're on timeout. Bye-bye. Okay, because he was doing too much. All right. Howard, Randy, I'm doing well. How about you? I'm trying to catch up on these so I can actually see them on the screen and stop looking down. So, okay. Kitty, hi, Howard. I'm doing good. How about yourself? Happy Saturday. All right. I see. Thanks for the advice. Definitely not planning to be arrogant. I know nothing yet, and you guys have decades of experience. Thanks for your words. You're welcome, Mr. Hernandez. And good luck on your journey, on your residency. It should be fine if you come across the right people. You're gonna come across some people that is just annoyed that they have a resident by them, but forget them. You stay sweet, and everything will fall perfectly. And remember that when you become a doctor, like without residency, and you just full-blown Dr. Hernandez. Okay? Remember that. And thanks for watching the channel. Okay. Juanita, let's get to what we saying, Juanita. Let's get to your comment, Juanita. Thinking for BSN from the start, but out of school since 2020 when I completed my credits for BSN. You got your ADN in 2019. First, oh, I remember now. You wanted to have a family first. Okay. So first one of your family to go to college and finish obtaining something. Oh, that's a blessing. Look at that, Juanita. So you know what you need to do? Set the bar high. Get that bachelor's. As you've waited from the start. So from the start, meaning 2019, or, well, you got your ADN in 2019. What is it now? 2024. You could have had your bachelor's in 2020. Juanita, take it. Take your courses. And let me know, do they offer online courses? Let me know that, Juanita, in the comments. Okay. Let me get back to other people. Savvy, guide me, please. Not being disrespectful, please. Genuine help needed. What do you need help with? I'm sorry. Did I miss your question? because it looks like the message was retracted, whatever you said. And I don't do that. I don't retract anything. Sometimes if it looks different from, whatever YouTube bots is out there, they'll hold something. Like in my shorts, there are people that's saying, oh, you deleted my message. And then it's, when I clicked in the other settings, it's hundreds of messages there that they held because they think they're offensive, and they're really not. But I get hundreds of comments on a daily basis in my shorts. So let me know if you could put that, however your question was, try to write it again, maybe in a different way. I'm not sure. Okay. Not to be disrespectful, LVNs are nurses as well. They 100% are. And I don't say LVNs, I say LPNs. And that's because that's the way it is in my state. And Tiffany, I only say that because I say nurses, but some people want to know the LPN, the RN. And I don't think that RNs and LPNs are any different. Some places, of course, the schooling, you take more school to be an RN. You take a different NCLEX to be an RN. But some places won't let LPNs do certain things. You can't do IV push meds. You can't do IV fluids other than saline. No. When I picked up a per diem shift at the ER that I started my nursing career with, the LPNs couldn't do certain things unless they took a certain class. Before that, they couldn't do anything in the ER but just give pills. So it made some of the RNs a little upset, because now if you're working with a LPN and they have any type of IV drips, you have to pass their meds, and they already were busy. So it's nothing wrong with an LVN, LPN, CNA, RN, NP, PA, resident. All of us are family. So hopefully I'm not giving you the attitude of LPNs are not it, because I'm a good friend with an LPN. I saw one of my friends that went from pharmacy tech to LPN to RN, and now she's going to be a midwife pretty soon. So it's always levels to it. It's nobody better than anybody, because we all got the same 24 hours, right? Okay. Supreme Divaful. Let me see. Where do I start? I'm in my 40s and I would love to get into nursing. And I only have a high school diploma. I want my LVN and beyond. Okay. So it depends. So do you want to, Supreme Diva, I'm going to just say Supreme Diva, what type of nursing do you want to get into? Do you want to get your LVN, your licensed vocational nursing, in a year? Or do you want to take an extra year and get your RN? Depending on where you are, some places only hire RNs for their nurses, and they kind of shade the LVNs and LPNs and only put them in a nursing home, just depending on where you are. I don't think it's right, because a nurse is a nurse, okay? If you pass boards, you a nurse. It don't matter. But some people want you to have more schooling. I guess that means more knowledge in that area. So let me know, Supreme, are you trying to, do you have the time to go to school for 2 years to get your associates? You don't have to get your bachelor's right off the bat. You're 40 years old, and you can go and spend a couple of years getting your RN. But if maybe it's time constraints and you want to just get your foot in healthcare, go get your LVN, do that 1 year. I believe, and correct me if I'm wrong, you have to work so many hours as an LVN and LPN in order to become an RN. So you're going to have to still, it's not like you could work as an LPN and then go directly back to be an RN. You got to have some time and some experience under your belt. So if you don't want to go through that, I would say go get your RN at a community college, get to working. If you want to keep going, you can do like I did, get in a get an online, I went to Chamberlain. Chamberlain is expensive, okay? They're not sponsored, they're expensive. But they gave me my degree, and they're accredited. So that's what I did. But it's all up to you. It's several ways that you could do that. But if you want to start off, do your research, get your, figure out where you want to be. Depending on where you are, look and see what the LVNs are doing in your state. If they're only at nursing homes and you don't want to do nursing homes, then go back to school to be an RN, registered nurse, okay? Hopefully that was helpful. Okay, it's so many comments. I need to catch up, so I'm going to look on my computer. Thank you for your wisdom, ma'am. No problem, Mr. Hernandez, and you're going to be an excellent doctor. I already see it because you're asking for, what to expect, how to mingle and coexist with nurses. But I'm just telling you right off the bat, everybody is not going to like you. But if you come to them humble, they'll open up to you. You come to me and you ask me stuff, I'm going to welcome you with open arms. Well, not really. I don't really be hugging on folks like that because around COVID, a lot of people don't touch no more. I give you a fist bump, though. I got you. Okay. Awesome, Juanita. So you have your BSN now. No, she's trying. She has the credits, but she's trying to go get her BSN CJC. And I'm trying to encourage her to go ahead and do it because she's been thinking about getting it for the past 5 years. And she could have already had it. But Juanita, you got this. Go ahead and get that bachelor's. And depending on where you work at, your job could pay for it. So find an online school. You have experience already as a nurse. Find an online school. See if your employer will do tuition reimbursement and go from there. Yes. Yep. Could have been done, Juanita. Been done. So you got this. So keep me posted, Juanita, because I know you're going back to school. And I know you're going back soon. Okay. Let's see. Been a while since I caught a live. Still taking courses towards nursing school. Miss Wealthy. Okay. What do you want to... excuse me. I'm talking a lot. That's why I have my water. What do you want to do? Are you trying to become a RN, LPN, nurse practitioner? Tell me what you're trying to accomplish, Miss Wealthy. And your name sounds familiar, like you were on my other channel that I had that got hacked. Maybe it's another Miss Wealthy, but me and you used to talk a lot on the lives. But this is a whole nother channel, so I'm not sure if this is you or not. If it is, hey girl. May Jesus Christ and Mary ever virgin be praised. Okay, now, R1A. Okay, Tiffany is talking to Juanita. You can do it. Just set an attainable goal for yourself. See, look, Juanita, you got other people encouraging you. You got this. You got this. 9 months. Ask your employer to pay for the courses that you taken, tuition reimbursement, all of that. You got this. And if you create a family on the way, remember, it's 9 months. You already passed boards. When you get your bachelor's, you don't have to take boards again. You just getting a higher degree. So with some employers, when you go from associates to bachelor's, there's a pay increase. You just show them what you got and they pay you more money. And with some employers, when you go from bachelor's to master's, you get more money. So get them coins, do them little 9 months, because even though you want a family, you still can have your family. Remember, you can do this online. You don't have to come into the school. You just have to do discussion board post, maybe a PowerPoint, a group project. No, I'm sorry. The group project was when I did my master's, so don't worry about that. Paper, okay, APA style paper. Discussion post, discussion board post every week, and a PowerPoint. You got this. Juanita, what you waiting on? You got this. And I don't even know you personally, but I'm rooting for you. You got this. Okay. Good to see you. So Miss Wealthy, were you on my other channel? Were you on my other channel? Because that channel got hacked on December 30th, and I was so upset because I didn't know if any of my people found me, and you did. So hey girl, hey. Okay. It's been my experience. Bachelor's isn't necessary. What's your end goal? Sorry, that was for Juanita. Okay, so it's not necessarily needed depending on what you're trying to do. If you have an end goal to get out of the bedside and to work something else, yes. If you want to get into management, yes. If you want to work your way up the ladder and go for your master's, of course. But if you want to be at the bedside, or maybe if you want to, well, I mean, you could work with your associates, it's no problem. But I mean, why not? Why not get your bachelor's? Because you never know when the facility you're working at is going to require it. Like now, I don't know if y'all heard, but like for, I think maybe next year, is it next year? For the nurse practitioners, they're now requiring, if not next year, it's soon. They're now requiring for nurse practitioners to get their doctorate in nursing, doctorate of nursing. So your master's is not enough. You got to go back to school and get your DNP. So it's always going to be something where they want you to increase your college knowledge, your experience. They're going to want you to do it. And it's okay, because most jobs will pay for it, because you making them look good, because you're how would I say this without being ghetto? I think I'm gonna just be ghetto. You're upping up your experience as a nurse, your credential as a nurse, and I don't know what happens behind the scenes of how many bachelor's, masters, associate nurses they have. Who cares? But it looks good. It looks good for you. So if you want to actually leave where you are after you get your bachelor's, you can say, oh, they'll ask you. Some places will ask you, oh, what type of degree do you have? Oh, I have a bachelor's. Or I have my master's. Not to sound bougie, but they asked you because they want to know this information. So 9 months, do it. But it's not necessary depending on where you're trying to be. Now, if you want to do something beyond the bedside and you want more money, some places won't pay you more money for your bachelor's, which I don't know why, but it's a lot of places that will. Okay, so Juanita, that's why you pause. You debating to see if it's necessary. But it has been a goal and a desire of yours. But it's necessary. But so wait, pause. Juanita, you said you paused because you were not sure if it was a necessity, right? But it's been a goal and a desire for you. You saying this. It's a goal and a desire for you to get your bachelor's. And you can do it in 9 months. That's enough time to carry a whole baby. This bachelor's is your whole baby you gonna carry, and you gonna get it. If that's a goal for you, do it. If that's something that you desire, don't let nobody change what you have a goal for and what you desire, because that's for you. I'm just encouraging you. I didn't know it was a desire, but now you really got to do it. It don't matter what nobody else is saying, because if you want to do this, you got it. You did the research. All you need to do is pick a date. Matter of fact, Juanita, pick a date in your mind. You don't have to say it in the comments. Pick a date in your mind when you want to do it. Hopefully within the next year, because 5 years then passed. The more you've been out of school, you're going to be like, oh my God, it's going to be 10 years, then it's going to be 20 years, and then you're going to be retiring. You're going to be like, I don't want to do it no more. Just do it. Okay. Thanks for those 100s. I saw them. All right. Let me see. That's true. Thanks, sis. You're welcome. Juanita, I'm not sure what you put, but it got retracted. Harlem Lights. Hi, it's Dr. Lynn from Atlanta. I'm off today watching your live. Hey, Dr. Lynn from Atlanta. Thank you for watching. Okay. Florida man. Hello from Florida. I'm interested in specialty care for skin and have women's health. Yes, I've had the time, but I would like to get my RA. What's RA? I'm sorry for not knowing that abbreviation. But specialty care is nice. You know what? I'm weird. Okay, don't judge me. If you want to laugh at me in the comments, laugh. Okay, but I'm one of those people, and my husband is like, I don't know, he's intrigued, but other people be like, oh, why would you? So I'm one of those. If I was to be an NP, if I was to be a nurse practitioner, I would be a dermatology nurse practitioner. I am one that love to see like the pimple pops and the cyst removals, and I love that stuff. I love it, and it grosses people out. And for me, I'm like, I will sit there and watch a full video, and then I have to watch it because my whole algorithm will be all like bumps, me and squoles, and I be just sitting and watching it for hours. So that's why I say I would be a dermatology NP. I would love to do that. I really would. I would give Botox injections and all of that. But I would love to like squeeze people's pimples or remove like slice a cyst and squeeze it. I don't know. Let me know if I'm weird in the comments, y'all. But I would love to do that. But I know when you go to school for NP, you know, those jobs are probably not that easy to obtain. You're probably going to have to do, you know, primary care or work in the ED, get some experience with that. I don't want to do that. I would want to be in the dermatology office. That's the only way you probably would see me back as an NP. Unless I do NP, because you could do NP and still be a manager. I've been in management as a nurse, and I don't mind going back. As well as you can use your NP to teach. That's something that I do want. I want my master's in education to teach. As well as you can be a clinician. So some people get their NP and they do multiple things with it. But that's the only reason, if I was to be a clinician, it would be for dermatology. So skincare, Supreme Diva, yes, I agree with you. Okay. Juanita, not in my experience. Money-wise, I make more than degree-holding nurses in my area due to specialized continued education. CJC. That is some good stuff. When you get that specialized continuing education, or like where I'm currently at, what you could do is you can take a course and get certified, and they give you money just to be certified for this area. It's a one-time bonus, but it's like you taking multiple classes, right? You taking multiple classes to get more money, but you could just get your bachelor's, and you can still take the classes on top. But that's just my opinion. My opinion. Okay, but I feel it depends on where you want to work. I work in trauma, surge, med surge, and a busy ER. Okay, CJC, got an ER background. Well, trauma surge. Okay. I probably would be behind the curve money wise if I worked the floor or a doctor's office. Yeah, absolutely. Because that when you get away from the bedside, they want to know your credential. They want to know, and once they may have a whole little list or some type of template that they look at based on what your credential is: RN, LPN, bachelor's, master's. I know they have it because some of the government hospitals have a template, and they'll tell you, if you have this, you on this level of pay. If you have this, you on this level of pay. And you go based off of experience. And so why not level up? It's 9 months. Okay. Supreme Diva, no nursing homes, thank you. I believe RN works for me. Well, you know what? Some nurses did start off in nursing homes. And I will say a lot of the videos that I share on my channel, the majority of the videos that's out here that's showing stuff that people want people to be aware of is the horror that their loved ones is going through. Not all nursing homes are like that, but it's a strong possibility that you may see a few people in that nursing home that's there to just get collect a check, and they just treat people however they want to treat them, which is unfortunate. But it is some good ones. You just got to do your research. You got to call. You got to drop in there, investigate to see what it looked like. If you go in a nursing home and as soon as you open up the door, it smell like pure piss, that ain't it. That ain't it. In my nose, I don't know what's wrong with my nares, because ever since I had my 6-year-old, it has not converted back. So I smell everything. So I would be sick to my stomach working in a nursing home, unfortunately. Okay, yes, LVN have to work before going to RN. I'm happy. I went straight from LVN to RN after my school changed. Okay, now you have to work a year. Yep. So like I was saying, you do have to work that year after you get your experience, then you can become an RN. But I mean, either way, you still working, but it's like now you got to juggle classes on top of working. Now, when you get your RN, you doing your clinicals and everything like that. But with your bachelor's, if you already have your associates, there's no clinicals. So you don't have to worry about that extra. You can just work and do your classes online or in afternoon, however you want to do them. Okay. As I started off as a CNA. This is Tiffany. It was a humbling experience. I'm love with, well, probably I love helping those in need. So it didn't take long for me to make a great decision to further my career as LVN. Okay, well, good. You know what? A lot of people want to get their foot in a door in healthcare, and CNA is the quickest thing. It may not be the best pay, but it's the quickest thing for you to get bedside, patient care, not hospital, healthcare experience. And just remember, if you're just trying to get your foot in the door, work that, but go back to school. Don't ever fall short of going back to school if your end goal is to be something better, because you can think like, oh, okay, well, I'm okay. I'm content with these paychecks that I'm getting. But then you look up, 20 years then passed by and you wanted to go back to school, but then you just kept doubting yourself. So I'm glad you kept going. All right. Miss Wealthy. So yes, it's the same person. I'm so happy to see you. I'm so happy because, like I said, my channel was hacked. It was like a fake brand deal where they used the company's name. I think it was either Dove or what's the lotion that I use? Um, Nivea, however you want to pronounce it. And I literally, because with your MacBook, it pretty much helps you to not be hacked. But I bought another computer and I said, okay, well, this is going to be my computer um for brand deals. So I downloaded this and it was malware on it. And somebody from Russia, if you from Russia, this is nothing against you, but they hacked me and it took a long time. To this day, I think last week, I was offered to dispute my channel. At first, I couldn't do anything. It was just a lost cause. So I started off from zero. And if you remember, it was Miss Wealthy, I was at about 20,000 subscribers. That was my old channel. So this one has flew off, and I'm so happy that I'm able to see one of my older subscribers. I'm so happy to see that. Not calling you old, girl, but I'm just saying it was a familiar name. So thank you for seeing me. Hopefully you subscribe to this channel. Okay. RN travel nursing is my desire. Because what did I talk about in the other channel? Travel nursing. I'm not currently traveling right now, but me and my husband is trying to get something really quick, and it requires me to be staff. But once that's done, baby, because these recruiters is contacting me, They're emailing me, they're texting me. One of my favorite recruiters called me last week, like, you sure you okay over there? I'm like, I'm trying. I'm giving this place a certain amount of time and I'm gone because I have to get some without saying too much. Y'all will see it if y'all subscribe. Y'all will see it in the future. I have to get some things and it requires me to be more in a stable income because traveling, 3 months, you can be off 3 months, you can work another 3 months. That's not stable for what I want. They don't want that. Okay, so I work a 9 to 5 and I take 2 classes a semester out of my pocket at a community college. Yes, that is literally what I did. That is what I did when I was at a community college. I worked part-time. Of course, back then my husband was my boyfriend. He helped me with the bills. If I ever said the story, he lived in an apartment. I lived in a house. Nope, we both were in separate apartments, but he picked up another job to help me pay my bills. My 2 older kids were from a previous relationship, and he helped me so much with them. Of course, my mother helped me, as well as my 2 older kids. Their grandparents helped me a lot. So it's a journey when you just going for your RN. That's the hardest part of school. So Juanita, the hardest part of school is that foundation. You already went from LVN to RN. Getting your bachelor's is going to be a breeze. I'm telling you, it's going to be a breeze. It's going to be a breeze. When you complete it, you're going to come back on the channel and be like, you were right. It's a breeze. So don't let nobody deter you from your goal. See, I'm going to keep coming back to you because I believe in you. I know you got this, Juanita. I know you do. Okay. Thank you, Mustafa. Appreciate that. Trying to make me blush. Okay, I can start online. So Supreme Diva, wait a minute. Let me go back. Are you okay? You want to go for RN. Now, when you go for RN, you said you wanted to go online. So, I'm trying to see, like, you can start online, but I would recommend you get your foundation from, just a community college, something that's least expensive. Sometimes the community colleges, help you way more than these 4-year degree college, these big universities. Community college, okay? Online, I don't recommend until you already have your associates. I don't want you to get your foundation from a computer. And also with some, if you're going to get your clinicals and stuff like that, but with some hospitals, if they see that you know, are a new nurse and you were at they know the online schools, the Capellas, the Waldens. I only recommend doing them when you already have your experience and you trying to get your master's, because I may be going to one of them. They're not sponsored though, but I may be going to one of them. So get your foundation from a community college where you sitting in a classroom. If you have questions, you don't have to worry about certain office hours. You can ask it right in class and go from there. I don't recommend online until after you get your associates, if that makes any sense. But that's just for me, because nursing is different. Anybody that's a nurse know that when you're in nursing school, it changes your whole mindset, and you need to be actually sitting in a classroom one-on-one with people. So if you don't understand it, you can ask a question. And if it's not portrayed, things can be portrayed differently when it's online. If you ask a question, they may be like, oh, well, what are you talking about? And it may not even be the way you're trying to say it. So people read text messages differently. They can read a question or an email differently too. So in person is probably the best to get your foundation. Okay. and skill sets. Okay, how come I overcome confusion in life? I don't know what you're confused about, Mustafa. I don't know. I don't know specifically what you're confused about, so I don't know if I can help you with that. Okay. All right, me too. I love trauma. Let me go back. Thanks for giving me the name of the special to care is dermatology nurse practitioner. Yeah. That right there, I would love that. And the hospital that I have, they have a dermatology clinic, but I know when you work at this particular place, they may have something for you, but it's no guarantee. So if they hiring for NPs, I might be a ER NP based on my background. I don't know. And you know, I don't know. I don't want to get something and then don't go in the area that I want, because then it's going to be a waste of my time and all of the money. Okay. Harlem Nights, hi there. Euro gynecology surgeon at Emory University. Where are you in Georgia? I'm wondering why so many RNs are leaving the bedside to become NPs. Let's collaborate. La 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 la. Let's collaborate. Okay, Harlem Nights. Is trying. Hold on. Wait a minute. Where is? Hold on. Let me scroll up. I think he's trying to, or she's trying to. I'm not sure. Harlem Nights MD. Wait a minute. Is this Lynn, or are you trying to get that to Lynn? Dr. Lynn. Who wrote Harlem Nights? Now I gotta try to find. Ah. Oh, it is Dr. Lynn. Okay, okay. Okay. So Dr. Lynn, let's go back. I'm sorry. I scrolled down too far. If you still on there, hold on. So I'm not in Georgia. I'm in Michigan. I did live in Georgia for about 5 years, but I was way young and I was like in middle school, like late elementary, middle school. But what I can say is I know that there are a lot of nurses leaving the bedside because it's terrible on your body, Dr. Lynn. It's terrible. I don't even work the bedside and I don't even want to go back to bedside. So if you want to continue to be a nurse and you want to get out of bedside, you either work for an insurance company, a clinic, infusion, or go back for NP. And more people want to go back for NP for the money. Yes, rest in peace to Sonia. Yes, I see that. Okay, I'm sorry, Dr. Lynn. I had to scroll to make sure that it was the same doctor, because I thought somebody was trying to reach out to you, but that's actually you. So no, I'm in Michigan, but a lot of people will leave the bedside and they will go to be a provider because they want more money and they don't want to do that grueling, patient care because it does a toll on your body. Now, a lot of the nurses that's in my area of expertise that I've came across, they'll go back to school to get their master's just to get out the bedside. Nurses that were nurses for 20, 30 years, they stayed at the bedside for a long time, or they moved up to be managers. So this generation of nurses, they just want to level up and not really work the bedside anymore. Well, that's good that you guys offer grants for bedside nurses in Georgia. Um. Okay. And Dr. Lynn, my email is always, well, I didn't put it on this video because this is the second live. It was on my old live, but most of the time, if you look in not my description, here, I will, My emails are in the description of like my live videos. But I can send you something if you want me to send you an email, either way. Okay. Juanita, good luck. I'm happy. Where is sit? But you have to find you. Yep, that's true. Uh, it may be 9 months, but you can do a course at that time, I think. Thin yellow line. That's true. That's definitely true. So me and CJC is encouraging you, Juanita, to go back to school or to take a course. Either way, you leveling yourself up. But do what's best for you. I just I'm going hard because you say that was one of your desires, and it's a goal. So knock that goal out, girl, if you want to. But I think you do. Okay. I agree. In school lectures are more effective than online, especially foundation. So, Dr. Lynn, right? Harlem Lights, MD. Um, I don't know if you're a part of the hiring process, but I'm just gonna ask you, what looks better for you? Does it matter if the nurse got her associate's degree at a community college or a trade school, or do you prefer somebody to get their bachelor's at a university? Yes, Dr. Lynn. But either way, it's fine. A nurse is a nurse to me. But I don't know what the higher ups want to look for. Because when I was in management, I wasn't a part of I was a part of the hiring process, but it was more so of, okay, what's your experience? And in order for you to work in that specialty that I was in, you needed at least an associate's, even to be a tech. So it's a little different in every specialty. They do look at your credential for sure. But bedside, they just like, come on, we need you, we short. Okay. I agree. In Los Angeles, the community colleges have awesome nursing programs and resources for students. Yep. Get into that community college because it's cost efficient, as well as you get better on hands-on help than online. Online, you pretty much you going through the curriculum and you have to teach yourself. Okay. All right. Minimum BSN. Okay. So Juanita, even the clinic, they want BSN nurses. I'm sure. Okay, wait, she wrote something else. 1 second. Um, our clinic accepts an associate's degree nurse, but must be willing to advance. Okay, so they'll get you with an associate's, but it's like, okay, you can get this now, but when are you trying to get your bachelor's? So again, it's better to level up. And now in today's time, it's okay to just have a bachelor's. Some people look at you like, you just got a bachelor's, why you don't have a master's? It's like, whoa, whoa, whoa. You gonna pay for them graduate classes? Because they're expensive. So I just wanted to hear from, a doctor's perspective. Thank you, Dr. Lynn. I appreciate that. And I wish I was in Georgia, but I'm in Michigan, so it is what it is. Georgia's a beautiful state. It is. But I appreciate that feedback because I want to just share to people that don't be so stagnant where you are because somebody is saying it's not worth it, or you can make more money doing this, but all this time has went past. I've worked with nurses that's been nurses for 30 years and they have their associates, but they're only doing bedside and they're okay with it, but they starting to get tired of it. Their feet hurting, their back hurting, and they're about to retire. I don't want to work like that. I don't want to work like that at all, where I'm beat down as a nurse. No, I want to still be able to get up refreshed, go into work, enjoy my patients, enjoy the staff, be a team with the doctors, the other nurses, the nurse practitioners, the aides, joyous because I'm not aching and bent over because I'm working too hard. No, not at the bedside, because when you injure yourself at the bedside, you'll look and pay attention to what do you want to do moving forward. I injured myself when I was pregnant with that little baby that's on my profile picture. When I was pregnant with her, I injured myself, and I'm like, I can't do bedside anymore because the patients were extra heavy and we didn't even have enough help back then. Okay? And this baby is 6. So think about that. 7 years ago when she was in the belly, mm-mm, mm-mm, nope. I need to be able to function. So you don't have to be bedside forever. Get your foundation at the bedside for sure, but that wasn't my end goal. Okay. I'm happy you acknowledge the laboring of nursing of the body. I have physical limitations and CNA route will not benefit me. So, oh yeah, the CNA, yeah. You did all you doing is not tossing, but all you doing is flipping, and not really flipping, but I'm just making an exaggeration. All you doing is just flipping patients, cleaning them up, getting vitals, feeding them if you need to, washing their hair, getting them dressed for the day, and it's multiple. So it's different when you're doing one for home care and you have your own pace, but it's different. It's strenuous, it's hurtful if you twist the wrong way, move the wrong way, get beat by someone, by a patient, when you're doing it at a hospital or a skilled nursing facility. So nursing is not for the weak. Healthcare is not for the weak. Okay. Let's go up to, I'm missing some stuff. Okay, Tiffany Jacks. And hopefully everybody that's looking right now are subscribed and gave me a like on the channel. I'm going to always say that. Hopefully you subscribe to the girl, because I'm telling you, I look at my analytics and I have 3.2 million people that look at this channel and they're not subscribed. Not all of them are subscribed. I appreciate my 160 plus. I love y'all. But if you're watching me and I'm giving you knowledge, because I'm going to try to keep up with these lives at least twice a month, because I like to interact. Of course, I'm going to do my shorts, but I like to interact with everybody too. Make sure you subscribe to the channel. I appreciate that. Okay. So, I don't want to work like that. So I'm getting my FNP and opening a clinic. Fuzzy spirals. I love that. You know what? It's a lot of people that did that during the pandemic. I went for my FNP during the pandemic, but I just didn't feel it in my spirit to become a clinician, so I dropped out. But what I should have done, actually I couldn't. The school that I was currently at, I asked them if I could switch to a different program. I wanted to go to something else. I wanted to do education. They didn't offer education. It was only FNP or geriatric nurse practitioner. They did not have education. Now they do, but now it's other schools that are way less expensive. So I'm going to make sure that I take care of me and go to the schools that'll give me the benefit for my money and take my credits for stuff that I've already done. Okay. I love caring for patients, but not like we do in this system. Got you. I understand. Fuzzy spirals. How far are you in getting your FNP, your nurse practitioner, family nurse practitioner? How far are you in school? Work-life balance is important. Yes, Dr. Lynn, it is. Really enjoy hearing. Yes, I'm gonna tell the truth in these lives. I mean, I say a little bit on the shorts. I try not to be one-sided, but sometimes I am, because if something is being done wrong, then shame on you. But when it comes to, people don't know what it is when they get into healthcare. They just look at, oh, I'm getting more money. oh, it's job security, but the truth needs to come out. And when I get my master's in education and I start teaching lecture and even maybe doing online courses, or if I even do clinical rotations with the students, I'm going to tell them nursing is not for the weak. Healthcare is not for the weak, because people will talk to you any kind of way. People will try to fight you. It's like, not everybody, but people need to know that everything is not peaches and cream in healthcare. That's why people need an increase. Doctors deal with all type of stuff. Nurses deal with all type of stuff. Aides deal with all type of stuff. But, are we paid for what we have to deal with when the hospital gets billions? No. On the outside, somebody that start making $40 an hour, oh, that's good money because I'm used to getting paid 12. But then you get in there and you deal with all that trash and you like, okay. And then you start hating what you do. It's a difference when you getting paid a good amount to where you gonna tough it out. Like, look, and $40 is pretty decent, but not for like me right now. No. But when you are actually thinking about all of the chaos that you have to go through, and say you get paid, say everybody get paid California bucks, like 60, 70, $80, $100 if you per diem. That's perfect. You'll deal with more things because you're getting paid more, but people can't afford to pay their staff more because they're paying other people more. Stuff costs, I understand. But you'll keep more people in healthcare if you just increase the rate. Everybody is short, right? They're always hiring people because somebody will level up and they'll go from a CNA to a nurse. So now they got to cover this. They need another CNA to cover because they have a nurse. Or maybe you go to another facility. Everybody is evolving and increasing themselves in healthcare, and they need to really make it more enticing for people to stay. Because if a job pay $1 more, people will leave that job that they're currently at and go to the other one just for that extra $1. Even though it's going to be taxed, it just looks better to get more money. Some places, they're not even giving annual increases, and that's terrible. Why would you not give an annual increase? Is it you're paying over your budget? You didn't factor that in? Your staff knows when they get an increase, they're waiting on it. Even though it's pennies, it helps. Mentally, it helps. Even if it's a little bit, even if it's an extra couple dollars on your check, it helps, because people will pick up overtime and they'll make them extra $1 or extra 50 cents or whatever. They'll make it work for them. That's something to entice them, to keep them to stay. But if you're not even giving an increase on your staff, why would they want to stay with you? Give them a bonus. If you can't give them an hourly increase, give them a Christmas bonus, or do something that's helpful to make them want to stay. Okay, let me look at these comments. I'm sorry, y'all. I'm on my little what do you call it? I'm on the stand. Okay, let me come on down. Okay. Tiffany, I agree. I will probably be traveling a distance and a starving student when I return to school this fall. What is F&P? Oh, family nurse practitioner. Oh, Fuzzy Spiral said it. Okay. I used to make my own schedule now. These hospitals have taken that away from us. Oh, are you serious? I was used to making my schedule too. I mean, I work at a clinic now, but when I worked the bedside, I made my schedule. It wasn't nothing to it. When I was in management, I pretty much would work 4 10s, but I would pick the day that I was off. So that's terrible. Like, for them to take away self-scheduling? Okay, out of the people that's still in the chat, that's still watching, if you are working in a hospital setting, or healthcare in general, if you're doing patient care, okay, not the people that work the barista, the people that work with patient care. Not discrediting the baristas, because y'all be coming through when somebody needs something to drink hot. Like if I want my tea and I left it at home. I love y'all. But for the people that do bedside care, if you were doing self-scheduling, are you still doing that now? I want to know if this is across the board, Fuzzy Spirals, because I would, when I worked per diem in the ER last year, I was still making my own schedule. So I want to know if it's changed across the board, or, you know, or what's going on. Okay. F&P is a master's in family nurse practitioner. We're able to prescribe orders and providers care as mid-level. Yep, sure do. I'm 3 semesters in. Oh, look at you. You got 5 to go. Nice. What school do you go to, Fuzzy Spirals? I'm getting all up in your business. Sorry. All up in your business. But congratulations. You almost there. You almost there. Okay. Thanks, Fuzzy Spirals. Love F&P better than seeing some doctors. Yeah. You know what? You know why, Supreme Diva? And not all doctors, because some doctors are amazing. I'm so sad that my primary care doctor retired during COVID, during the pandemic, because she was so amazing. She was so sweet. She was very thorough. And back then I was a little pre-diabetic. I had a little weight on me. And she said, you need to lose 10% of your weight. I did better. I lost, let me see. Ooh, I didn't even do the math. But instead of losing 19 pounds, I lost about 35. And when I went to my new primary care, I got my everything tested. They said, oh, you're not pre-diabetic, because automatically I think diabetes, I think of dialysis. I think hypertension, I think dialysis, because I worked in that area. And all of those patients, unless they were in an accident and they have acute kidney failure, the chronic ones usually have high blood pressure or diabetes. That's black. Okay. And I was scared to even be sitting on a machine for that long, let alone I try to be as healthy as I can. Okay. Let's see. Oh, and one more thing. So the doctor that I had that was so sweet, at the end of the time that at the end of our visit, she would pray over you. You don't get that. You don't get that nowhere. This lady was such a sweetheart. She would dictate her note in front of you so you know exactly what she was putting in your chart. And at the end, she would pray over you. If y'all got a doctor like that, let me know. I miss her. I really miss her. This lady used to be booked up. Because booked up for months. You couldn't even get in there. So if you wanted to see her 4 months out, you'd call right now. That's how booked up she was. Okay. It always pays off at the end. Focus and stay grounded and knowing that you will come out on the top of the... Yeah, see, I love that y'all are encouraging one another. I love that. I tend to encourage people, but when I have people in the comments encouraging, I love that, because so many people tear each other down and it's not even worth it. Uplift people. Make them feel better. Give them the knowledge that they need, you know? Okay. All right. Okay, Dr. Lynn, have you had any issues with private equity consuming local hospitals where you work? No. Nope. Fuzzy, do something, pay me. I don't know where that was from. Fuzzy Spirals. Let's see. Yes, the more money you make, the more the higher the nurse-patient ratio. Could be 2 nurses, 40 RNs at UCLA. My sister is at UCLA, and the doctors should agree. RNs should have even more money. See, and that's coming from a doctor. Harlem Nights MD is that's Dr. Lynn. She's even saying that we need more money. And I don't know how long it's going to take for people to get an increase? Because I know where I am, I did I don't know if it was from this channel or from my previous, but I did the top, was it the top 10 or the top 15 healthcare states for nurses? And Michigan wasn't even on, it was in the middle. It was like 20 something. And I get paid a pretty penny because I kind of know how to navigate where I need to work at. But everybody don't know where to go and who to talk to and what to do. They don't. So, you know, I always say for people to do their research, get your experience. Make sure your resume is up to par. Okay, because people will look at my resume and say, okay, well, you have critical care experience, you've been in management as a nurse, you have your bachelor's, you are in committees for this and that, and you have, like, if I'm doing something to do anything with patient care, I was a phlebotomist before a nurse for about 8 years. So I've been in healthcare for a while. And not a nurse for forever, but been in healthcare for a while. I've only been a nurse close to 10 years. And you need to be paid your worth. If you are a brand new nurse and you think you're going to get paid $50 an hour, that's not the case. Unless you're doing per diem and you getting $50 per hour for like a home care patient to help them with something. You're not going to get a full-time job making $50 an hour if you're not in one of those states that the pay is up there, because New York pay up there, California pay up there. I think, is it Boston too? I'm one of those. But nope, you're not getting that. So if you're not getting your worth at your current, do your research. And it's nothing wrong with when the place that you're interviewing asked you what your rate of pay is currently. They want to know what to pay you because, and correct me if I'm wrong in the comments, they want to know what you're getting paid so that they can give you 1 penny more. I remember when I went from ER to ICU and they asked me, oh, well, how much money do you make? So I told them and they offered me that amount plus a penny more. Now, back then, I didn't know. I was a novice. I didn't know. So what I tell people is if you are going from one job to another, okay, if you going from one hospital to another and they asked you what your current rate of pay is, tell them another dollar. If you getting paid $28, tell them 29. So at least you'll get 29.01. Because if you're going from one job to another job and you're not getting paid more, it's a problem. That's just my little tip for y'all to remember. Keep that in your brain bank whenever you're trying to get another role or another job and they ask you how much you're getting paid. And it's some jobs they won't ask you. They'll just give you whatever. And it's up to you to take it. If you don't want it, you can always counter. If they're not trying to give you more, then say, unfortunately, this is not the right rate for me, but thank you for your time. You don't want to cuss them out or anything. You just politely say, unfortunately, this is not the rate that I will sign and work for you for. I'll continue to look in other facilities. You have a blessed day, or you have a wonderful day, or whatever you want to say to them. But just let them know, no, that's not enough. Now, sometimes they'll say, oh, well, what about this? And then some of them will just let you go. Okay, so let me get back. I go to a large state school. I'm not saying the name. You don't have to. It's okay. School is online and hybrid with an excellent board pass score. I'm not saying the name until I graduate and done. Okay, Fuzzy Spiral. So hopefully you are subscribed to the channel because I want to know that name. Because, well, do they offer masters in education there, nursing education? Let me know. Dr. Lynn, yes, I loved her. I loved her. I was so upset when they wanted to pass me off to the people in the office. I'm like, no, that's not her. That's not her. I don't want her. I don't want them. I want my doctor back. So anyway, um, all right, you're providing excellent information. I've recently started watching YouTube since I am on sabbatical due to my health. Your coverage of nursing home care is excellent. Oh, well, hopefully your health gets better, Dr. Lynn, and I'll keep you in my prayers. But thank you for watching. Hopefully you subscribe to the channel. And let's see. Yes, I quote more. Absolutely, you have to. But you know what, Juanita? A lot of people don't know. They don't know to quote more. They're just being. It's like you lying in a way. You are, but your honesty, you get stumped on. You literally get stumped on. So if I would have known back then, okay, well, I'm gonna tell them I get paid $30, $31 instead of 30, so I would get offered at least $1 more. I thank you, Dr. Lynn, for subscribing. It's unfortunate that you have to do that, but they already not paying a lot of healthcare their worth. Okay. When I worked in transplant as a coordinator, this is right before I started traveling. There was a doctor. I think you could actually see what the doctors was making, and I made the same amount of money when I traveled. I really did. So when I mentioned earlier that I made doctors money, I did. I did. I saved it. I put money up for my kids' college funds. I did some fixings around the house, the yard. I made sure that the bills was paid. I spent a lot of money on little knickknacks and stuff. Well, who not gonna do that? But you know, I enjoyed it. I really did. I miss travel. The rates are not as much as what they were. They start trickling on down, and I used to only get contracts that was 3,000 a week. Now it's like you look at the contracts, they like 2,000, maybe 2,500. And it's like, dang, y'all just really, 3,000 was the minimum. Now it's like you gotta really look to see what's going on. So hopefully when I decide to go back to travel, you know, it's gonna be worth it. I mean, travel is not going anywhere, but I like to do local assignments. So meaning I'm staying in Michigan and I'm not away from my home. And I'm licensed in here in Ohio. So if I see something that's close, I can drive to Ohio and come right back home. So is what it is. Okay, so let me look at this. Try to stay on day shift, even though midnight's more money. It's horrible on your. Yes, it is. Come on, Dr. Lynn. I like that you engage with. Come on with your doctor knowledge and you engaging with the audience. Yes, because when I started as a new nurse, I only could do midnights. They didn't offer anything for day shift. When you worked at a facility, the only opening was nights. The reason why is because the night shift people, when a day shift nurse left, they would take their shift. It was never any availability on the outside. They would allow the night shifters they already working there, so let's just move you up and let's get somebody new for nights. Of course, they're gonna pay you an extra $2, $3, and then weekend shifts is gonna be good. But it does a toll on your body. Your whole body is different. When you're off, your sleep is weird. Of course, it'll make it look good, like, okay, well, I'm working nights so the kids can go to school. I can take a nap. You become an expert napper when you do midnights. When you do day shift, you do your regular stuff. If you need to take off to see your doctor, you have PTO, take the day off or take a half a day or do whatever you got to do. But you need that sleep because sleep heals your body. It heals you. So if you work in midnights and you're able to come home, take your kids to school if you have children. If not, you go to sleep, you wake up, you eat whatever. And then what I did was I literally came home, took the kids to school, went to bed, got up at 2 o'clock, got ready, ate something, got ready to pick my kids up, helped them with homework, and an hour before I left, I took an hour nap. I just had to get them naps in. And when I was off, it was like I couldn't go directly to sleep at a good time. I would be up at 2, 3, 4 o'clock in the morning, and I'm off. So it just ruins what's going on with you. If you love midnights, more power to you. But for me, I like day shift. But of course, they entice you with more money when you work midnights, because your body shouldn't be working on midnights. But patients need care, so they're gonna pay you more to stay up while the CEO and the higher ups is all asleep. Okay, let me see. Yes, my school offers master in education. Okay, so anybody else want to talk about anything? I know I've been on this live and my other live for probably maybe a couple of hours combined. But hopefully y'all are already subscribed to the channel. But if you want to talk about something, I'm opening it up to y'all. I really appreciate y'all for coming in and chatting with me. If you've been seeing this channel and you've paid attention to my lives, you know that I do my lives when my little one is taking a nap. So pretty soon my husband is getting off of work and I will be ending the live, but I do want to chat with y'all a little bit. You know, and go from there, because she's still sleeping. He's not home yet. So okay, let me see. I worked as a behavioral health nurse for 12 hours. Now I'm a case manager and still trying to manage sleep. So, how long have you been a case manager, Tiffany? Let me see. When we collaborate, we'll cover how much sunlight is required. Oh, okay. So here, this is what I'm gonna do. For Dr. Lynn, here's my email. So I put your name on it. You just add the .com. That's my email. Send me an email and then we can come up with something. I would love to. I would love to collaborate. Okay. I have my associates and I have my CMA. What's the best advice to go further? So Michelle, what are you trying to do per se? And hello, Cassie from Alaska. What are you trying to do per se? You have your associates, but your associates in what? In what degree? You have your certified is that MA? So that's medical assistant, certified medical assistant. But what degree do you have with your associates, and what are you trying to do? Because you say advise moving forward. Okay. Tiffany. So 6 months, nope, 9 months. Okay. So, okay, cool. I'm glad you got it, Dr. Lynn. Talk to you soon. So, it's going to take some time for your body to adapt. And with case management, I'm sure you work, Monday through Friday. Because I don't think they do 12-hour shifts for case management. Well, nope, they do, depending on where you are in a hospital or if you do work from home. So if you do work from home, that's just a Monday through Friday and maybe a rotating weekend. But if you work, like, say, the ER and they want you in the ER as a case manager, then you do a 12-hour shift. But you have to, when you're working, you have to force yourself to, like, make sure you're not taking naps anymore. Don't take any naps. Oh, you working from home? Oh, okay. So are you drinking tea or coffee to keep yourself up? Tiffany, I think you should, I'm trying to think. So when it comes to night shift, it ruins you. It ruins you. But some people love it. What I would say was I would fight, like if you want to take a nap during the day, I will fight that to the T. Just fight it, okay? Make your body so tired when you make your body so tired that when it's time to go to bed, I mean, not saying you got to go to bed at 8 o'clock, 9 o'clock, or 10, 11 o'clock when it's time to go to bed, that your body is just like, and you are ready to literally like just pass out. You got to force yourself to get back into that rhythm, because I had to do it. I literally had to force myself. When you're working from home, it's like it's nobody there looking at you. You just on the phone and talking to whoever, and maybe some Zoom calls, and it's like, how am I gonna stay up? So I understand where you're coming from, because I've been there, but you just have to fight through it. You have to fight. Yes, pray and fight, because it may take a year. But you gotta you have to get up. Like, if okay, Tiffany, are you falling asleep on the computer, like at the desk? Are you falling asleep? Hopefully you have a desk and a chair where you're sitting upright and you're not like doing anything laid out in your comfortable bed type deal. Because when I worked from home during the pandemic, when I was a coordinator, I would get up, I would make my tea, I still had a robe on, but if we had to do a Zoom, I would have like a t-shirt on or something like that, some pajama pants, because okay, I'm not going to work in the hospital, so I don't have to put on scrubs. But I would mimic sitting up, and I literally was on the couch. I had my front window wide open so the sunlight was in there, and you just got to mimic like you're sitting at a desk. Hopefully you are. Let me see what you're saying. Okay, Juanita, I did case management 8 to 4:30 for 9 months. I'm still trying to figure out the sleep. Prior to, I worked night shift in the hospital. Yeah. Yep, it's definitely something that you gotta figure out. It's tough when your body is conditioned for nights and then you have to go to day shift. It's like you a zombie, you fighting sleep. But when you get your body conditioned into day shift, you good. You just gotta fight through it. Unfortunately, it's not depending on how long you've worked midnights. I don't think it'll take the equivalent time to get yourself together, but you gotta fight. Okay. Okay, so let's see. No ma'am, I do, but sometimes I sit in my recliner. No. And for you to say recliner, I know your feet be up. I know your feet be up relaxing, because whenever I'm in a family room and we watching on the surround sound in our projector, we have like a couch recliner. So in the middle, we can put like an armrest down, and we can put our drinks and plug up a phone and put the remotes there. And my husband can recline on his side, I can recline on my side. But when I'm sitting, automatically, I'm not sitting with like how I am right here. I'm laid back, my feet up, I'm pushing the seat back. No, that is not what you do, Tiffany. You need to get a regular chair. Don't sit in that recliner at all. Get in a regular chair with the back straight that you can't move back. The uncomfortablest chair, okay? If it's if it's hard on your back, put a pillow back there. Get in a chair, sit upright. You gotta fight. Do not get in that recliner until you get your body together, because that recliner, I'm sure, is comfortable, it's soft, your feet up, you in relaxed mode. Nope, don't do it. Okay, right. It's a process. Girl, I'm getting a little too comfortable. I'm going back to school soon. Okay. Okay. Wait, Tiffany, did you tell me where you were going back to school for? I'm sorry, it's a few people in here. Okay, and did I miss Michelle? Okay, Michelle, you want to work in postpartum. Okay, so what you can do, I'm sorry, my hand is itching. It's the wrong side. The money side is here, right? um, so if you want to go into postpartum, are you trying to work as a nurse? I don't know if you told me what you have your associate's degree in, but if you want to go into postpartum, yes, get dressed and sit up. Yes, I got dressed, but it wasn't like coordinator clothes where I'm dress pants, dress shirt, heels. No, t-shirt, pajama pants, robe, because we keep the air on in the house. And if it got hot, take the robe off. But yeah, Tiffany, let me know when you get it together, because you get out that recliner, girl. You too comfortable. You too comfortable. Okay. But for Michelle, for postpartum, if you're trying to be, I'm not sure if you're trying to go back to school to be a nurse or a nurse assistant, because you can be both and work in postpartum. But if you're trying to be a nurse, RN, LPN, LVN, nurse, of course you go into school, but you can work mother baby, you can work labor and delivery. Sometimes with labor and delivery, they'll have you to rotate. So you're rotating. You may be with the mom before she delivers, as well as they may rotate you to mother baby, as well as you may be doing mother baby is what is it, postpartum. Yeah, so usually labor and delivery, there's a rotation. But if you get to this point where you're interviewing, just ask, is there a rotation with postpartum? I want to be with postpartum. Is it a requirement for me to work labor and delivery and there's a rotation? Just ask, because when you ask everything during that interview, everything. And if they want you to work that job, they gonna tell you some stuff. But if you ask the right questions, the truth will come out. You just got to know what to ask. People don't know what to ask. So that's what I'll say about that. Okay. Let me go back to these comments. Okay, Dr. Lynn, mother baby is a good place for postpartum. Yep, mother baby. Juanita, yes, ma'am. I like that advice. Yep. Tiffany, you better get up, girl. Quit playing with that recliner. Okay, I wake up early too. At one point, I was getting up about 10 minutes before it was time. Not good. Better to wake up early, even though I was just walking across the house. Yes, because when I did work from home for those 3 months, as a coordinator, I would get up. If I was still tired, I would get in the shower. And then I would come downstairs, because my bedrooms are upstairs. I would come downstairs, make my tea, get ready, because we would have calls, and we had daily calls that you had to be up for, and some of them you had to cut on your camera, some of them you didn't. So set the tone, not just getting up a few minutes before. Get up, 30 minutes, an hour. Set it up like you getting ready to go out the door to go to your job. So you could do that. You absolutely can do it. Anybody else want to talk about anything? I'm all yours to talk, to discuss whatever you want to do. The people that be saying these little sad comments, I know how to mute, not mute, but what was it? I know how to put you on timeout. I don't remember that being a thing when I had my other channel, because when you do lives, people always are gonna say little off the wall stuff that's not subscribed, but they just want some attention to just joke around and play, because it's internet people, it's internet bullies, it's bots, It's all type of stuff. But, you know, I just kind of like blow it off. It don't even bother me. But if anybody else want to talk about anything, let me know. And hopefully everybody that is watching is subscribed to the channel and has gave your girl a like on this video. If y'all tired of me, if y'all tired of hearing me say it, I should see the likes increase. The likes and the likes and the views should be the same, and they're not. And liking somebody's video is free. If you don't want to subscribe, cool. Just give me a like. Anybody else want to talk about anything? I'm surprised the little one is still asleep. Usually she coming down interrupting stuff, but she's still knocked out. Anybody else? Thank you, Tiffany. And keep me updated on your journey. And hopefully you taking Juanita and I's advice by not sitting. Well, it's my advice not to sit in the recliner, but Juanita's advice to get up early and, you know, start off your day like you about to go to work. But you said you going back to school. Did you tell me what you was going back to school? Oh, you did. LVM, RMBSN. Okay, awesome. And it looks like hubby is here. So if y'all want to say something really quick in the chat, let me know. If not, I'm tend to my man. And he already know about the live. So, okay, I really appreciate you. Okay, I send you my channel name. I will send you my channel name, which is medical oriented. Most of the people will be medical community. Thank you for your prayers. Let's see. Oh, my little button is in the way. I can't read all of your message. I was DC'd in February. Okay. So actually, see ya. Okay, Dr. Lynn. I look forward to seeing your email. Okay. Anybody else want to say something? Oh, I didn't let my dog out. I forgot to feed the dog. I got to feed my little poodle too, because I hear him barking because my husband home. So anybody else want to say anything before I end this? Let me know. I'm still here. Oh, diagnosed. Diagnosed. When I see DC comma D, I thought of that, but it's DX. Okay, you was diagnosed. Gotcha. Thanks for the live and for the motivation. Juanita, you got this, girl. You got this. That's all I'm gonna say. The rest is up to you. I'm a be on top of your journey, as well as Tiffany, you going back to school too. It's somebody else that's going back to school. I'm gonna be checking in on y'all, especially in these lives, because I remember names. Y'all see, I remembered Miss Wealthy from my old channel before it was hacked. Okay, so anybody else before I end it? I'm starting to lose my voice. Anybody else? All right, if nobody else is saying anything, I'm going to end it because my husband is home. I hear the garage close. Y'all have a blessed weekend. Hopefully y'all subscribe to the channel. Dr. Lynn, I will look forward to collaborating with you, and keep me posted, ladies, on y'all journeys to go from the next step in nursing, as well as anybody else that's encouraged to go back to school. Do it. Okay, do not wait, because the clock is ticking, and it's gonna keep ticking when you procrastinate and you should have went back. Absolutely do it. Y'all have a blessed one, y'all.